I pass the baton to the president of AIM at Melanoma, Samantha Guild. She's an amazing advocate for our community, melanoma community. She will introduce some of the valuable resources for our patient, caregiver, and providers.
Thank you so much. First, I want to thank all of the presenters. We're actually going to be hearing from one more person today from Kaiser. But I do want to say thank you for those who've already presented and remind people that if you have questions to please reach out. So for example, Cheryl, just to give you a heads up, we heard about how you were able to, have it really to stay positive. And I'm going to be coming back to you in a moment, asking you to share how you were able to do that. I know we've heard from many patients and families and caregivers over the years about how difficult it is to stay positive when you are being treated for a melanoma diagnosis. And so if you could come back at some point and share with us how you're able to do that and continue to remain positive, knowing that you could be, dealing with treatments again. So please keep that in mind. But what I do want to do is to share with you, I'm going to pull up my presentation, some of the resources that we can provide all of you. And of course, as usual, Eric, I'm going to have you jump in because I'm having difficulties again with my PowerPoint. So while he does that, so we started, thank you, Eric. Our organization has been around for many years. Get it back to the first slide, Eric, thanks. So we've been around for many years. My family actually started, my mother started the foundation back in 2004 after my sister had been diagnosed with stage 4 melanoma and passed away. She was 26 at the time. And at the time, there was very little that was available for melanoma patients. And we knew that we had to do something. And our primary goal at the time was to find a cure for melanoma and bring an end to this disease. But in the interim, in doing that, my mother leading the charge started AIM at Melanoma and started creating a whole host of resources to support everyone, to provide information, reliable, relevant, and current information on all aspects of the disease. Eric, next slide. So we hold many patient educational events. We hold them also for healthcare providers as well, but I'm going to be talking about the ones that we provide for the patients. One of the things that we know is that many melanoma patients do develop brain metastasis, and there's a lot of questions around that. And we're fortunate that later this month that we're going to be hearing from Dr. Bella Olivia Glitza from MD Anderson. Brain metastasis is her specialty, and she's going to be joining us on May 27th at 7 p.m. It's a webinar. You can go to our website and register, as well as watching it on Facebook for those who are joining us on Facebook. And next slide, please. So we hold multiple symposiums throughout the year, just like this one. Our last one for the spring is going to be next Saturday, same time, same place, with the University of Miami, Sylvester Comprehensive Cancer Center. You can find that on our website to register, to join us. We have also, by the way, there all the videos from our past events. And then we're going to be starting up again in the fall with some new locations, hopefully maybe 1 or 2 in person with social distancing, etc. But they're all going to be live stream. But at some point when we do go back in person, you'll be able to join us no matter where you are. Next slide. But I really want to encourage everybody to visit our website. There's a whole host of resources. We've heard about many of the FDA, we've heard about, I think, well, almost all of the FDA approved treatments, if not all of them. We have symptom and side effect management resource guides where you can pull up these sheets and find suggestions on how to manage your side effects. We encourage you to print those out and bring them to your healthcare provider. There's the video library of the past symposium events that I mentioned. Of course, hearing from melanoma survivors is very important. It brings us hope. It lets us know that there's a way to go through this journey, and there's others out there who can help you. And so you can find those clinical trials, a very important aspect of the melanoma treatments. You're not required to go through to be involved with those, but certainly that's something that we encourage people to know about. We have a peer-to-peer connect program where we have mentors and mentees work together. We also have a comprehensive list of helpful organizations, financial, emotional, housing, etc. We have our Steps Against Melanoma walks to help raise awareness, bring people together. Those will be currently planned or being in person. And there's actually, for those in California, there'll be one in Northern and Southern California. We don't have a location yet, but for many of our locations, those have been set. Lots of volunteer opportunities. We are leading effort to ban minors from indoor tanning devices. We work on, we look for volunteers to help us at these in-person events, share their stories, etc. And then I do want to mention, we have a physician assistant that people can reach out to. It's free. We have a phone number, also a form on our website. And Melissa, who actually works at UPMC in her real job, she helps us out by answering questions about melanoma and gives you some general information so that you can eventually go back to your healthcare provider and get those answered. Eric, I'm done. So if you have any questions, I certainly want to encourage you to reach out to us. We have a toll-free number. You can email us, hit reply, but we are here to help you. And if there's anything that we can do to help, let us know.